My name is Kylie Christensen. I am going to be performing remediation for the scale of a subcutaneous injection. I needed to do remediation because I wasn't using the correct size needle, and I recapped the needle after administering it. I am using a 1-inch needle. I do not have in my kit, I don't have a 5/8 inch needle, which I was marked off for on my original video. A 1-inch needle could be a potential option for administering a subcutaneous injection depending on the size of my patient. A 5/8 inch 25 gauge needle is probably the most preferred size needle and most commonly used, but in this case, my patient is going to be using a 1-inch needle because that's the supply I have available, and will be the option once I do the pinch test for them. So hopefully that's understandable. Alrighty, I'm supposed to resume my skill from the hand hygiene portion, so that's where we're going to go ahead and go. So I'm going to go ahead and perform hand hygiene and apply my gloves. Alrighty. I am going to start by using an alcohol swab to clean the top of the vial. And then I want to make sure I have the correct size syringe and I have the correct size needle. So I need a 3mm syringe, which I have right here. And then in this case, I have a 25 gauge needle, 1/8 inch, 1-inch needle, 25 gauge. 5/8 inch might be the preferred for most patients, but in this case, I'm using the 1-inch needle because that's what I have for this patient. So I will go ahead and get the top of the needle put on. So I have my needle. Now that this is all cleaned off, I'm going to go ahead and carefully remove the cap of the needle. I'm going to start by pulling out 1 ml of air and injecting the air into the vial, and then pulling out 1 ml of heparin. We want to make sure to get rid of all the bubbles. Perfect. So that's 1 ml of heparin. And for our administration today, we are going to be choosing the abdominal site. Before I inject anything, I will gently or carefully recap my needle in case I prepared it in a different location. So once this is recapped, I will then label it with the dosage and the medication, which is 1 ml of heparin. I then will bring it to the patient. I'm going to go ahead and clean the patient's site of administration. So starting from the inside, going in circular motions on the outside. I'm going to let it dry. We did choose the abdominal site today. We're going to make sure we are more than 5 centimeters away from the umbilicus on the left or the right side. I want to inspect the site, make sure there's no bruising, no cuts, no scrapes, no abnormal redness. I want to make sure there hasn't been an injection here recently. And then I want to palpate it gently to make sure that that's okay. Once I've done that, I'm going to grab another alcohol swab since I shouldn't have touched it yet, and I'm going to clean it one more time. So this is so inside to the outside, and I'll go ahead and let it air dry without blowing on it. So now that the site is clean, I am going to go ahead and prepare it for injection. So I'm going to carefully remove the cap, and we will pinch the skin. When you're doing a subcutaneous injection, you want it to be at a 45-degree angle, 45 to 90. So pinch the skin. We're going to go ahead and inject. And since it's heparin, we're going to keep the skin pinched, and it's going to be a slow 30-second injection. So slow and steady. Okay, so once that's done, we're gonna go ahead and remove this. Grab the gauze. I will dispose of this in the sharps container. And it's an anticoagulant, so there could be extra bleeding. We're gonna hold this for about 30 seconds. All right, we've held it for the proper amount of time. If the patient would like a Band-Aid, we would put a Band-Aid on for them. In this case, the patient is fine. I will remove my gloves. Make sure I take the medicine, dispose of all my supplies, and then I will go document my results.